Hi everyone, thank you so much today for joining us for Caregiving Through a Doctor's Eyes. My name is Nicole Clagett and I am the Director of Community Development and Caregiver Support for Duke HomeCare and Hospice. And it is my pleasure to talk today with Dr. Yoon Kim, who is a physician, a geriatrician actually, with the Duke Geriatrics Clinic.
Thanks for having me.
Of course. So, I think one of the biggest issues that family caregivers have is, how do I prepare for that doctor's office visit? It can be really overwhelming sometimes when you walk in and you have all of these thoughts going through your mind about, what should I ask the doctor? How should I ask it? How do I remember what I'm doing, what's going on with my loved ones? So give us some advice about how a caregiver should prepare for that physician's visit.
Yeah, that's a great question. So, I work at like you said, I work at the Duke Geriatrics Clinic, and a lot of times people come in because they might be feeling a little overwhelmed with caring for their loved one, or might be feeling like they have some needs that still need to be addressed. And so really sitting down and thinking about the priorities for the visit and thinking about the goals is really important. Sometimes it's helpful to write things out and think about, how kind of what your biggest concerns are so that we can understand how to address those concerns and work together as a team. I think, also preparing your medications is really important, making sure that if you're not 100% sure what someone's taking, then bring all the medications. That way we can review it during the visit. But if you have an updated medication list, that's perfect. That's really important to know what especially older adults are taking. And let's see, I think it's also helpful for us to know ahead of time, if you'd like to speak with a provider separately. A lot of times, caregivers might have some uncomfortable topics that they want to discuss, like driving or concerns about behaviors that they don't want to talk about in front of their loved one. And so letting us know ahead of the visit is nice, because then we can kind of figure out a way to make some time to discuss that privately. So calling our office ahead of time and just letting someone know, and so they can make a note in the chart. Maybe I've had people bring in notes to pass off to the nurse to hand to me before I actually see the patient. That can be helpful too, to just somehow give us a heads up, and then we can work out a way to discuss these real issues and make sure that we keep our patients safe. And let's see, other things, making sure that you think about who all should be involved in this visit. So, if it's a quick visit, that's one thing, but if it's an initial intake visit, it can be helpful to have, if there's another caregiver who's very involved, having them either come in with you or on speakerphone can be helpful, so that they can weigh in and give their 2 cents. Also in our specific clinic, our social worker reaches out to all patients and families before the initial visit. And that can be really helpful in gathering more information. So most of our visit can be spent, I've already reviewed that information, and we can review some of it during the visit, but the majority of our visit can be spent kind of coming up with a plan, and assessing the situation and being able to make sure that we are all on the same page and moving on from there.
So one of the things that you brought up that I thought was particularly interesting and I think would be quite helpful was really coming in with examples of what you're experiencing at home. I think sometimes when we come in and we talk with a family caregiver, with a physician, you might be so filled with all of the thoughts that are going on in your mind that you don't necessarily know kind of how to explain what's going on at home. I think sometimes families feel like they're not heard by physicians when they say things like, I just think there's something wrong with mom's memory. What would be a good way for that family member to describe to you, instead of just saying something's wrong with memory? What would be a good way for them to actually illustrate that to you?
Yeah, so everyone's different, and so I know some people have brought in a recording of somebody. If somebody is I had one patient who felt like things were crawling on them, so kind of recording something to bring in an example of what that looks like. I think the primary way that people kind of illustrate this for me is by writing down examples or privately speaking with me, because a lot of these things can be a little uncomfortable if the patient has little insight into their deficits or the concerns that the caregiver has. It can be uncomfortable to talk about in a group setting in the visit, and so really trying to somehow either talk about it, write it down, or again, if it's easier to bring in another way to show me, then that's fine too. So I think really, as long as we understand the concern and how we can best address it, that's the most important thing. So whatever way that families feel is most effective is helpful.
So another thing that you brought up that I thought was really interesting was bringing in the medications that the person's taking. Mm-hmm. And I think sometimes people see doctors with many different specialties, mm-hmm. right? You might see a geriatrician, you might see a cardiologist, you might see an orthopedist, and sometimes nobody really knows all of the medications that the person's taking. So mm-hmm. I think that is really key. Also, what about those over-the-counters too, right? Aren't there medications sometimes that maybe they've been taking it for 30 years?
Yeah.
And they shouldn't be taking some of those medications. Maybe those things shouldn't be taken when you're an older adult. So do you talk to people about that, or kind of how do you figure out how to make that work?
Yeah, definitely. That's a great question. I think knowing exactly what everyone's taking, and that's why it's important to bring in the medications so that we can see. Sometimes I've had cases where I pull out all the pill bottles and someone's like, oh, I haven't taken that in 3 years, and so it's like, we should get rid of that medicine, that shouldn't be in your house, especially if it's a higher risk medicine. And, in terms of the supplements, those are really important. I think a lot of times we think if it's over the counter, then it's fine, but it's good to know what everyone's taking, because there are some medications over the counter that can interact with other medications. Other prescription medications can increase your risk of bleeding, things like that. So it's good to know, to have that whole picture. And even medications that aren't prescribed by me or by primary care, for example, beta blockers or medications that help control your heart rate. Some people will come in with like 2 or 3 different pill bottles, and they've been instructed to stop one of those medications and they're still taking 2. So being able to see that and have that clarity is really helpful.
I would imagine, too, that it can be difficult after a person gets discharged from the hospital, because when you have a hospitalization, sometimes your new medicines are added, and they may not necessarily know what you used to take. Mm-hmm. So how do you kind of work to reconcile that with a family?
Yeah, that's a great question, and that is definitely something that we struggle with a lot, because a lot of our older adults or more medically fragile patients are on a lot of medications. And so again, bringing in all the medications, or a list, and making sure it's also really helpful to know when the last time you took something was. Did they take all of their blood pressure medications that morning, or did they not, and that's why their blood pressure is so high in the emergency room. Mm-hmm. And so really having a good inventory and also knowing kind of when the last time someone took something is really helpful. In terms of discharge, on the other hand, really going back to that paper that someone is discharged with is really important, because that will outline all of the changes. And if you notice a discrepancy or have any questions, it's really important to ask before you leave the hospital, because you can definitely ask your primary care doctor, who should have access to the records, but making sure that you have all of your questions answered before you head out of the hospital, so that there are no errors or questions once you leave is really helpful. Sometimes there are services to have a pharmacist or a nurse to come in and help review these medications, to review the changes. And so, possibly asking for that service if you feel uncomfortable is really helpful.
Yeah, that really makes a lot of sense. So, I think one of the challenges, and I've been a family caregiver twice personally too, I think one of the challenges that people sometimes have is around those family dynamics, and you have sometimes a number of family members that are expressing different interests and desires for that individual who may not be able to speak for themselves. How do you see yourself in that role, helping a family navigate some of those dynamics?
Yeah, that's a great question, and it can certainly get challenging, as I'm sure you can imagine or you've seen. So really thinking ahead of time is ideal. So I'll kind of start from when someone is able to make those decisions. That is really ideal because I see that as honoring the patient or loved one's wishes. That's where advanced care planning comes into place. So identifying a healthcare power of attorney or several, you can actually identify 2 or 3 folks if you are able to trust that they can come to an agreement typically. Most people do choose just one though, and that certainly makes things a little bit easier for the healthcare team. So having that documented is really helpful. That document has to be notarized, and it can't really be done once someone loses capacity. So once they're unable to make decisions on their own, once they're unable to reliably choose the same person over and over again, and be able to document that, that's when things get a little difficult. And so if there are multiple players and no documentation, hopefully the ideal situation is that everyone is on the same page and that's not a big issue. If everyone agrees with the plan that we recommend or that makes medical sense, then that's great, and we can all just kind of move on with this plan. I've definitely been in many situations where, especially in the hospital, if somebody is really sick or we're trying to figure out the best plan for a long-term plan, and there's a lot of discrepancy between the family members or loved ones, who have a valid investment in that person's care, it can get challenging. And so sometimes we have to recommend pursuing guardianship, which is unfortunate because that's a court process, and it can be very tedious and take a long time, and that person can end up being in the hospital for a very, very long time while that process is worked out in the court system. But really, we can't really pick and choose as the medical providers who to listen to, since there are legal recommendations in place. So we have to go by that, and it can get a little a little challenging when there are lots of members involved and differing opinions. So, again, ideally, just kind of going back to what I said in the beginning, trying to get that straightened out earlier on is really helpful for everyone.
So I guess for those that are listening who have not done advanced care planning with their loved one who's still able to make decisions, or even just think about yourself, right? I have my advanced directives already set.
That's
it's
wonderful.
super important because you don't want people to make assumptions about what you would have wanted if you're suddenly in a situation where you can't make that choice. It's crucial because when you leave, when you pass away, those relationships or those family members are what's going to be left. And if there was a lot of fighting, some of those things never get healed.
Yeah. I saw a patient the other day who her healthcare power of attorney is her oldest son, because she said that she and he are on the same page in terms of her health wishes and what she would want in emergencies or non-emergent situations. She said that her husband and other children were thought differently, and she trusted her oldest son to make that decision. And so I think kind of taking into account having those discussions and really being thoughtful in who would be your healthcare power of attorney, your go-to person for us, is really important.
And not just who you think you should name out of guilt, or you feel like it should be the eldest, or it has to be my husband. Really, who's the one, like you said, who's on the same page. I think that makes total sense. So what about, you mentioned a little bit ago about some of those kind of passing a note to the doctor before the visit so you don't have to say something in front of your loved one. Where do you see a physician being able to step in and help with some of those more difficult situations. You mentioned maybe driving as one.
Yeah, so I hate to bring it up in a kind of secretive way or anything like that, but there are these real issues that pose health concerns and safety concerns. So, these are difficult situations and difficult topics to discuss, but important and necessary. And so, I think having us as a third party, we are, I don't want to say happy to be, but we are willing to be the bad guys, you know. And so, I'm okay if I feel strongly that I'm really concerned about someone's ability to drive, then I want to express that. And I want to know from the caregivers if that's a genuine concern. If you would not ride in the car with that person, then maybe they should have some more exploration into their driving abilities. And I try to phrase it as it's not just a danger, it's just not a risk that you're taking for yourself, but a risk that you're putting on other people on the road. And so just really being mindful of that. We do have through Duke, we have a driving assessment that we offer through the occupational therapy program, just down the street from our clinic. And so I recommend that to a lot of folks. It's $200 out of pocket, not covered by insurance, but it has brought some clarity to some people who need a little bit more information and more of an assessment or evaluation.
Yeah, and I think it also helps. I've heard of people going through that, especially people who maybe it's not necessarily a cognitive issue that they wouldn't understand why they can't drive because of the deficit, but maybe more of a physical issue to really see. Well, I've now been put into this situation, and if those 5 cones were people, they would have been injured or killed. And and I think sometimes that's just the wake-up call we need. It's not, my daughter's trying to take away my control, because really, imagine someone taking her license away tomorrow. That's horrifying. How would I even get to work? And how would I do the things I want to do every single day? So I can imagine that would be a horrible thing to even face as an older adult, losing that independence. So another thing that you brought up that I think we should touch on a little bit is sort of one of those note passing off experiences, having those conversations about placement, right? And so I think a lot of people have made promises to loved ones. I promise I will never put you in a nursing home or a facility or a building. But at some point, sometimes, it's just, you could have never envisioned what it was going to take to get that person the rest of the way through it. Some of these chronic illnesses just last so long. And how do you find, what do you do to help that family caregiver kind of get through that point to the other side?
Yeah, and one thing that I really appreciate about this particular conference is the focus on the caregivers, because for me, especially when I see older adults, the caregiver is big of a part of the puzzle of this triad as the patient and myself. And so really making sure that person is healthy and able to kind of care for themselves as well, because if they're not able to care for themselves, then they can't really care for that person either. And so kind of keeping everybody's well-being in mind is really how I approach things. And so I think it's really hard when, like you said, people have made a promise to not place somebody or, go that route. But one thing that I encourage caregivers to think about is, just to give an example, I had a patient who promised her husband with advanced dementia and lots of, behavioral concerns, lots of wandering and physical, physical altercations. She promised him a long time ago that she would not, put him in a nursing facility like his family member. However, one thing that I talked to her about was that she could not have predicted, or he could not have predicted, that he would be in a different situation. The family member that he had did not have those types of behaviors that, were not able to be controlled easily, and so I think situations change, and really having that flexibility in your mind and your heart to be able to say, this is a little bit more than what I can handle. Even though I made that promise, what is best for the patient or the loved one, what is best for the caregiver, and nothing is forever. And so if you decide to place somebody and you decide that that's not a good arrangement, you can always go back, so nothing is set in stone. You're not saying that they have to be there forever, but really keeping in mind that this could go on for years and what is sustainable. How do you also have a quality of life as a caregiver and take care of your own health? Because a lot of caregivers are, spouses or for me, for older adults, a lot of the caregivers are older and have their own health issues. And so really being able to think about that as well as my patient is really important.
So what do you view the role of a caregiver to that individual they're partnering with and caring for?
Making sure that they are safe. I think that's, for me, one of the top priorities. Safety is one of the biggest things that we look at for kind of an arrangement. If someone is living alone, does that caregiver have enough, oversight to be able to trust that when they leave, things will be okay? And, so that caregiver, I know it is not an easy role. It is sometimes a thankless role, and I think it's hard in the heat of the moment to step back and recognize that, but it's really important as providers that we do that. So I think being able to see that and being able to support that role, because this person would not be able to be in the position that they're in without that caregiver, and so for me, there's a lot of love and respect, and I just appreciate that so much because, I have seen that personally as well, and, it's hard, and the whole situation is hard. It affects a lot of people, not just that one caregiver, and so really taking that into account and appreciating them for what they do is really important.
So not everybody who's attending this event has a loved one with a cognitive impairment. Sometimes there are physical impairments, things like Parkinson's or MS, or maybe they're just getting to be more frail as an elder. Sometimes people are just not easy to live with or to work with in any sort of way. What do you suggest to family caregivers who are sort of in that situation where they are the only person in that person's life, and maybe they haven't always been that great. Maybe they haven't been a great mom or dad or brother or sister. How do you help those caregivers kind of keep their fuel during the time they're assisting a loved one that, if it wasn't, they may not want to do it if they didn't really feel like they had to?
Yeah, that's a great question, and that can definitely be very challenging. I think making sure that this loved one or patient has all of the resources that they can get, I think is really important, because that takes some burden off of that caregiver. So making sure that they're plugged into specialty care if needed, different support groups and those sorts of things. Making sure that the caregiver gets respite. So there are, unfortunately, a lot of these things are out of pocket, but there are also organizations that provide volunteers for even 1 or 2 hours to be able to allow that caregiver to have respite, But if, for example, pain is a big concern, making sure that that pain is as optimized as possible is really important, because if it is, then everyone's happy, So making sure to treat kind of the underlying issues as well as possible, and also making sure that that caregiver also is plugged into all the resources that are possible. I think you and I talked a little bit about social work, and so social workers are so amazing in this field because they have a wealth of knowledge of all of the resources in the community, and really nationally. There are lots of resources, and so I don't know them all, and a lot of times I turn to our social workers who are so helpful and truly care and will do what they can to help mitigate that burden.
That's great. So switching gears a little bit, recently we have more and more devices out there. We have those little watches that you can wear that can tell you your oxygen level, how many steps you walk, things of that nature. Is it helpful for a family caregiver to bring all that data with them to a doctor's appointment?
Probably not. I will say for me, I probably wouldn't find that as helpful because I like to focus on the big picture. So maybe if you were a physical therapist, it really depends on who the audience is. Maybe if you were a physical therapist, that would actually be helpful to know how much activity they're getting and what they're able to do. For me, I like to look at the broader picture and care less about the steps. I do care if someone's walking every day, and for how long, and how someone's sleeping or things like that for oxygen levels and heart rate and things that monitor people so closely. Probably not as important on that micro level, more on the bigger scale.
Sure.
We want to know if someone's short of breath, if someone feels unwell, and then they should come in for a visit, and maybe they're in AFib, atrial fibrillation, where there's an abnormal rhythm of your heart, and that is why you're feeling so unwell. It's similar to those baby monitors that exist that kind of track your baby's oxygen and heart rate and all of those things while they're sleeping. I tend to recommend people shying away from those because it can heighten anxiety. Yeah, it can heighten anxiety and kind of cause some unnecessary, intervention.
Mm-hmm. So another question I have for you, not to put you on the spot, but maybe I am a little bit. Caregivers often talk about the reluctance of some physicians, not necessarily geriatricians, but in general, some physicians to put a loved one on services for end-of-life care, such as hospice or palliative care. And they'll ask, I want to sign my loved one up. I feel like they're near end of life, but my doctor won't do it. How do you help a caregiver advocate for something they feel like they would like end-of-life care, hospice care, to a physician?
Yeah, so, that's a great question, and I actually really encourage those services if they meet the eligibility, and for palliative care, really anyone can receive palliative care services. So I certainly encourage that if needed and if desired, it can help keep people out of the hospital, keep their symptoms better managed, and so in terms of hospice, both of these programs kind of look at prioritizing comfort and prioritizing kind of the patient's wishes and needs. And so hospice can be scary for a lot of folks. And if someone does meet that criteria, I think it is a great service, and I do my best to try to educate people on hospice because, again, it is an effort to keep people comfortable, to keep people at home or at their facility. Hospice and palliative care can both go into facilities. And so if you have a loved one in a facility, you can actually receive those services at those facilities, or they can. So just knowing that is really helpful because a lot of people don't realize that. But, hospice can really provide a lot of comfort and calm to what might be a sometimes chaotic situation in some certain circumstances.
It wraps more services around that family unit during a very difficult time. And I think sometimes people view it as giving up.
Yeah.
I'm giving up on my loved one, where the reality of it is a lot of times people rally.
Yeah, that is certainly
because
true.
there's so much more wrapped around them. And that's social workers and chaplains and nurses and then the physicians are involved. So it's pretty fantastic based on my experience. So.
Certainly, yeah.
So in the little bit of time we have left, Dr. Kim, what do you think healthcare could be doing better for caregivers?
So I think, one thing that is difficult for everyone in healthcare is time. I wish I could spend so much more time with my patients and loved ones, and I love hearing stories of, for my patients with memory loss, what did they enjoy doing before it became advanced, a little bit more about their background and a fuller picture of this person. So being able to have time to explore that and to get a better picture of somebody, to me, is really important, and I think also to the patient and caregiver. I think also along with that, making sure that we are doing what's called shared decision making. So not just, I think decades ago it used to be a little bit more the physician recommended this and this is what's going to happen. Now healthcare has really shifted, or at least I think most providers have shifted to shared decision making where we discuss maybe a variety of options, maybe have a preference for one or a recommendation, but really it's ultimately a shared decision. And in this case, with the caregiver, it would be between the provider, patient, and the caregiver to all come to a shared decision about what's best. And so kind of exploring all the options and making sure that all the questions are answered, everyone feels comfortable with decisions that are being made, and voices are being heard.
Well, I really appreciate this candid conversation we had today. I appreciate the gift of your time, and I hope this was helpful to everyone watching.
Thank you, Nicole.